Hello, everyone. Welcome to the PDO Max web chat. I am very excited today to talk about ROI in threads. This has such value to it, and we have industry experts with us as well as Geo. And welcome to one of our top 25 accounts. Sonia, introduce yourself. And Shelby.
Hi, I'm Sonia Ellis, and I own the Lab Med Spa, and we're located in South Lake, Texas. And Shelby just opened up our satellite office in Dallas, so we now have two locations. Hopefully, five in the next 5 years. Y'all ask me in 5 years. It's what I tell everybody. So I've been a nurse for over 30 years. I've been in plastic surgery and aesthetic for over 25 years. I've been injecting for 20 years, and I opened up my practice about 7 years ago.
Welcome. Thank you.
Yeah, and
So,
I'm Shelby.
Shelby.
Hi, I'm Shelby, and I'm a nurse injector at the Lab Med Spa, and I've been at the lab since 2020. I've been in the aesthetic industry for 8 years now, and I've been injecting or utilizing threads in my within my practice since 2021, we said. When fell in love
Yes, we
with them.
figured out that it was 2021. Yeah.
When I fell in love.
Excellent. And you are a PDO Max trainer as well.
Yes, I am.
We're going to be spotlighting you soon as one of our practitioners. So welcome. Thank you so much for being here. And Gio, welcome. How's it going out there? Let's I can't wait to chat about ROI.
Everything's great. It's nice to have Sonia and Shelby on. It's great to have people who understand and love threads and understand how they work in a practice. So excited to talk to them and see how they've structured it and what's working and what's not working for them. Especially in this state of regenerative medicine, threads absolutely fit into that model.
Mm-hmm. For sure. And so today we're going to break down the real numbers behind thread treatments and why they've become really the highest ROI procedure in aesthetic medicine. So let's get started. I have questions and I know that we have a lot to talk about. So I just welcome you guys to go off from there and chime in at any time if you want to even add on. So first, let's start with when you see treatments like neck thread generating over $1,500 in profit and the supply cost, we're just giving vague numbers here, $200, how should you reshape the way providers think about time-based revenue in their practice? Looking at just a basic thread procedure, we'll start from there.
So I'll speak to that for being the owner first, and then
Mm-hmm.
Shelby can speak to that being a provider because obviously
Perfect.
what they bring in is, we can't legally pay off of commission based, but you can bonus your providers on what they're bringing in. So of course, what
Mm-hmm.
they're making matters to their paycheck, even
Mm-hmm.
though we can't pay off commission. So, as an owner, we're looking for high return ROIs that the patient's
Mm-hmm.
going to be happy with, that the provider can safely, do, in the practice. And threads is definitely one of them. But I think as we get into this webinar, we'll get into why training is so important and complications, and you just have to think of everything as a whole. But as far as a neck procedure, it's one of my favorite things to do is smooth threads in the neck. Sometimes I'll even add biologics in, so I'll draw the patient's PRF. And if
Mm-hmm.
y'all all know, the smooth thread has a hub, and you can just attach your PRF to that hub, place all those smooth threads in the neck, and then you can baste all of those threads with some PRF before you, take the needle out. So the patients have always been really happy with the results, and really one of my favorite procedures to do for neck rejuvenation.
Awesome. Great insight.
Yeah, and I think
Shelby, anything to
from
add?
a provider perspective, like Sonia was saying, I mean, the way I get paid, the lower my costs are on my product, the more bonus I get. So threads, I love using neck threads, like Sonia was saying, the smooth threads. It's something that I have my patients getting. I've kind of now have my patients getting it every time they come in to get talks, so 3 or 4 times a year. And my patients love them. They're super easy to do. I can throw in a ton of neck threads or even my barb threads in under like 15 minutes, get them in, get them out. And yeah, knowing that my time, I'm having high procedures within like 30 minutes, and then my cost, yeah, it's barely anything, and then I just get paid more off of that.
That's great. Well, thank you for being transparent about the compensation piece of it, because I think that that is valuable, nationally to see how practices are incentivizing their staff. And that's really great to hear that and see that, especially when you're looking at profit margin. That's huge. So Threads, I'm sure Threads is your go-to for that reason, because that's, probably the best toolbox that you have to offer in a practice with that ROI. That's great. Gio, anything to add?
Yeah, I would definitely, like Sonia said, so much of this is training. But once you're trained and once you're good, you're really charging for the service and not the product, right? We should never look at um, this as, geez, it's less expensive, so let's use it. The reality is they're great because you have trained hard, you have become good at them, and they work, right? And you're charging for your time and expertise. That's really the way we should be looking at this. And really, this is the way we should be looking at any procedure that we do. It's interesting to me how the industry evolved, and one of the things that really was a problem is this whole per syringe charge. It should have never gone that way, because these are service providers and they should be charging based on their skill set and how good they become in the work they put into. Yes, it only takes maybe 15 minutes, like Shelby said, but why? Because Shelby has spent a ton of time training, becoming good to be that fast. We're not trading speed for efficacy or for being good at what we do. She can do it that fast because she has trained many times and become good at it and has no complications.
And to piggyback on you, Gio, I totally agree. And I think also making my patients feel confident in knowing that if something does happen, I'm here for you. So yeah, I love that you mentioned that. Yeah, I love my threads. I do them a lot. So
and the more you do them, the less chance of complications.
Yes.
Let's face reality. We all know the thread complications, and they're actually pretty easy to manage if you are confident and you are knowledgeable and you've done your training. The problem with threads, as somebody who has started the thread industry, one of the ones who started the thread industry, is at the beginning the lack of people understanding the complications and understanding how to deal with them. They're actually pretty easy to deal with if you know what you're doing.
yeah,
I agree.
Really great point. So from a sales standpoint, of course, being leading a sales team, I talk with the team a lot on how to approach practices about threads and adding this to their practice. And a lot of times the approach is the training piece. You are relying on your skill and that technique and not necessarily using other devices as the crutch. So it's not about the device so much, but it's the skill set and the results that you're gaining from XYZ. And of course, in our mind, it's threads, and maybe with combination treatment, which brings us to the next question. So let's talk about under eye thread treatments, the range of that and the profitability of it. And also, maybe Shelby and of course, Gio, talk about how you are doing some combination treatments as well and how those pair well together with the profit margin.
Actually, I'm gonna start.
All right, you go.
Even though, and the only reason I'm gonna start here is because I've been doing this for 20 years and we have done horrible things to the tear trough in that time. And so just everybody stop, please stop. There is not a lot that you can put in the tear trough and be successful. And two of the things that we are most successful with in our office is the threads and the PRF, and also a combination of the two. And I'm just going to leave it at that. Like, we've done horrible, horrible things.
Horrible. We've seen.
The tear trough is one of the hardest areas to treat, and threads makes it pretty easy.
And safe. I would say safe too. Because we got, sorry, Jay, I didn't mean to cut you off.
Go ahead, Shelby. I was just
no, Yeah, one of my biggest favorite things for the tier trough that I like to use are the Smuth blunt threads. And those, I mean, I know complication wise, or it's going to be I have a decreased chance of having a complication or having an adverse event. And I know they're going to do its thing, stimulate that collagen and elastin, build up some volume in that area that patients are wanting. And again, I can do them safely, know my patient's going to be safe, compared to filler.
And to piggyback off that, I can tell you, we go back to, been doing it since 2014. So you're talking, I have 11 years of not just one practice doing them, but thousands of practices. And I can tell you that if I have seen one complication or two, it's really strictly on the skill. It's not on the product. We've never had nightmare problems in the cheer trough with threads.
Mhm.
The safety, the results, because at the end of the day, just like Sonia said, we've seen some horrible things, right? And when for 11 years you've seen nothing horrible with a procedure, even when somebody doesn't have great skill set, we're not seeing horrible things. It says a lot about the safety, and the results are fantastic. And when you pair them with, like Sonia said, a PRF, a PRFM, something like that, you're just getting great skin quality. And everything about aesthetics should be about great skin quality. It shouldn't be about dramatic changes or things that we can't quote unquote reverse, right? It should, we're here to make people feel good. So we should all be making sure that what we do prevents those problems.
Yeah, and one thing I'd like to add to that within the PDO Max portfolio, I do think there's something for every different type of skin quality.
Yep.
So there's not just one size fits all. Whereas with filler, yeah, I mean, I made bad mistakes. I've been in it for 8 years, on patients and had to fix it and just went, use one of my PDO threads and corrected it, and they're fine. But I love that with PDO Max, there's an option for everyone.
Yeah.
It's just being a provider, knowing which one to use for that patient.
Well, and once we introduce the boosters to
Oh,
microneedle,
yeah.
those again, doing things ethically and well makes the difference. We won't ever be able to correct every problem for everyone, but there is a thread for that, as we say.
Yeah.
Absolutely. And I love that you mentioned the skin booster piece of it as well, because that is just another great amenity and topper for what you're already doing. We talk about this trifecta from your barb to smooth to then being able to utilize PDO Afterglow or PDRN with Lumembi. So we have that as well. And that having a really great profit margin too, because cost of treatment for those serums and even our glow pen are very low, and you're charging 250, 350 up,
Well,
as an
and
add-on for a lot of services that our practices offer.
as a company, it's something that really matters to me that the ROI for the business is there because they're the ones doing the treatments. They're the ones
Mhm.
that every day put their license out there, their life out there. And I want them to be able to be successful and be able to take care of their business. So many things in our industry have gotten so expensive to the point that it's hard to push that cost onto the consumer. And
Mhm.
especially in this day and age where finances are tough for everyone, we wanted to bring in products that work, but weren't costing the practice fortune.
Yeah,
Mhm.
absolutely.
No, as a practice owner, we appreciate that because it is very hard right now. We're in a recession. Women are not spending as much, in the medical spas. They're having a hard time deciding, am I going to do my lashes? Am I going to do my nails? Am I going to go get my neurotoxin? Now, filler is down 15 to 20%. Luckily, we're a diversified practice where we do, offer lasers, we offer functional medicine, we offer threads, we offer dermal filler, we offer neurotoxin skincare. So, we're not the type of practice that it's going to be difficult for because we're just going to sell them something else. But not as many people are coming in, and as Gio said, and so it is very hard as a practice owner or somebody that owns a practice to tell a patient how much that's going to cost when they're telling you how expensive groceries were that month, but they
Mhm.
just want to look pretty. They want to do something nice for themselves. So we appreciate that because there
Yeah.
are some other products out there that are comparable, but they're just astronomically priced, and it's just like,
I don't get when our cost is such and you have to pass it on. And it's like, okay,
yeah.
microneedling shouldn't cost $1,000, right?
No, it
Right.
should
So
not.
that's
They're
why
going to need, in order for them to get a good result from that, they're going to need, we all know they're going to need 3 to 6.
three,
And
Exactly.
so who's going to spend $3,000? Like,
right.
you
Mhm.
know, that's a full ablative erbium CO2 laser resurfacing. And
Mhm.
we all know they're not going to get those results from it. So like now they're going to get great results, but they're not going to get a $3,000 result. And then the patient's just going to be mad at you.
Yeah.
So you do have to sell ethically, in my opinion.
Mhm.
100%. And I think that we're seeing that in the industry. The practices that have been doing that all along are doing great still. The ones
Mhm.
that
That's the kind of practice we are. One
yeah,
of my mission statements is you better not sell it to them if they don't need it. If they
Yeah.
exactly.
need it, sell it to them all day long. I don't care. But if they don't need it, I better not find you selling that to that patient.
And
Yeah.
that's why it was so important for me to give you guys products that give great ROIs
Mhm.
Mhm.
because something has to, right?
Yeah.
Yeah. Well, and with that result where we are able to see a patient more frequently or a client more frequently, if we are doing those skin boosters and microneedling in between those thread procedures. And so it really is a nice combination of both, especially if the practices out there are doing memberships. And so many times, and Gio, I've spoken with Ryan about this, is having that membership and having that added value having that be the lower ROI product that is given as the extra, as the incentive to be part of the series that you're offering or the membership programs, whatever it might be, keeping in mind these lower ROI treatments are great to utilize for that because it's not costing you as much, but there's high perceived value and result.
We also offer these supplementations for our laser patients, just so you know. So it doesn't have to
Nice.
be just microneedling. It
Yeah.
can anytime you're putting a channel into the skin
Yeah.
and you want to put something on top of it, that is a great time for them to also use the PDO Glow and the PDRN.
Beautiful, isn't
Absolutely.
it?
Mhm.
I mean, I'm just finished my third treatment because, of course, the shoemakers
Right.
don't have shoes, right? So I finally, booked my appointments with our med spa, and I've just got my third one, and I just cannot believe how amazing my skin feels. It's like, why do we put off doing things for ourselves, knowing how
Mhm.
well they work?
Mhm.
Yeah.
Yeah,
And some
anytime I do it, I look like a fetus for like 4 weeks.
Yeah, right.
True. It's so true.
I'm like, I've got fetus status. I love it.
Yeah,
That's something that I tell my patients too. I can inject thousands of dollars into your face, but if your skin isn't top tier, it doesn't matter.
matter.
Mhm.
So, yeah,
Mhm.
that's when I bring in the skin boosters. I'm like, yes, I'm already lifting your face, but now I still need to top it off superficially with
To
either,
tighten up
the
that
PPO
skin.
Glow or the Lumenv.
Yep.
Yes, absolutely.
I, I
Absolutely.
I've been in the industry since I was 16, as everybody all knows. You're talking 43 years in the industry. And I go back to, it's funny how all of a sudden, and really just only in the last 5 years, all the plastic surgeons are now coming out with, skin quality. But we've been saying that for 40 years. It's like, it doesn't matter how great everything else is, if their skin, which is what we see, isn't of good quality. And that's why when we started creating the skin boosters, not only was it important for me to have the right products in it, but to have the right price point because
Mhm.
everybody should be able to afford good skin.
Hmm.
Yeah, absolutely. And
Well,
you
and
you say that all the
some
time.
people aren't good. If they would just do their skincare every day, it would probably work out for them and be okay.
Yes.
But you have certain people out there. me included, that
Yep.
will not do skincare every day. I know I own a med spa, and
Mhm.
yeah, I'm not going to wash my face every night. It's not going to happen. Sometimes I'm just going to fall asleep with a laptop on my body, and I'm just going to go to sleep. So this is a great way to reset that clock for those people that just will not do that skincare every day like they're supposed to.
More
This
Mhm.
than
is one of the things that we
I
use
agree
to
with you.
rescue them.
Mhm.
I
Yeah,
love
that's a great rescue. It's so
It's a
true.
rescue. Like, okay, you won't do what you're supposed to do. Okay, so we're going to give you about a month's worth of skincare in one treatment. You're
but
welcome.
that's exactly it, Sonia. It's like for me, I'm so reactive to retinols that like to be read every
Mm,
single day gets
Yeah.
to be a lot, right?
yeah.
I won't mention the brand, but I was using one and I loved it. But every day I was beet red. And you sit there and go, okay, I'd rather be beet red for a day and then I'm good for a month.
Yeah.
Right.
Makes sense. So, the common denominator here has definitely been talking about ethically selling and effectively integrating threads for that core revenue just stream and that driver. So, if you can share, maybe even look at it like full face, really look at the big picture of it. What are your best practices in when you're first doing your consultation to the end results, and like what is their journey? And how has that really added to your practice during times where filler is down and we're in a bit of an economic change here?
That's all you, Shelby.
I think for me, whenever I'm discussing with my patients about the threads and their expectations, I like to describe it as like I'm building a house, right? Especially for someone with a little bit of a fuller face. And I know that cost wise, yes, I could probably, because they need maybe, I don't know, 3 or 4 syringes per side to get the same lift that I can do with threads. That will, again, cost the practice less money, but they're still going to get a really good result. And typically, if I'm going to be doing like a full face, I'm doing anywhere between 12 to 15 threads for like upper, lower, my levo locks. And that they're going to get a good duration out of that, the thread lifting procedure. And again, from the money side of it, they're going to be saving a little bit more money if versus if I were to use filler on them. But the results are going to be just, I mean, they're going to be even better than me using filler. And again, from a business perspective, Sonia's going to have a little bit more money in her pocket, the business pocket.
Yeah.
So that we can buy the equipment, so that we can bring on
Yeah.
people
Mhm.
to help you guys work and work more efficiently. I think that that's the other thing people forget. When you're running a business, there's more than just the expense for the injector.
Yeah.
You have a medical assistant, if you have a front desk person, you got to be able to pay all these people. And if your ROI isn't there, we can be altruistic and pretend that we don't need to make a profit, but you can't have people hired and be able to give them benefits and do all the stuff. So it's really crazy to think that profit isn't important, ROI isn't the most important part of running a business, an ethical business, because you
Mhm.
want to be able to pay people what they're worth.
Hmm.
So Shelby nailed it on the head. It's exactly what I would have said. I look at certain patients. Like for me, for instance, please don't put filler in my face. Please. I've got it for days. What I need you to do is take all of this heavy tissue and I need you to lift it, right? So, but as Shelby was stating, um, making sure that your patient is a good candidate is number one. Like, do not sell a thread to somebody who is not a candidate for it. If they have really thin skin, if they really do need that volume versus that lifting. But if they need that lifting, you are going to make the patient so much happier and save them so much money and make the practice more money if you choose threads, because you're going to be able to lift all those tissues and get that filler look that the patient is looking for, that their friend got, that doesn't have the same face shape that they do with those threads. Now, my other thing that I want to say about that is please don't do too little threads, okay? It's the worst thing that you could do is let the patient dictate how many threads you're going to put in their face. Absolutely not. We did that when we first started because we just didn't know, and all it did was disappoint us and disappoint the patient.
Right.
And so I think our minimum is 6, Shelby. Is
I
that
mean,
our
yeah, I would say for
absolute
the,
minimum that we will put in?
yeah, I mean, I think a lot of my
And
patients,
really, we like 10. Really,
I think,
we 10 is our favorite to start with, but I think 6 is the absolute minimum that we will put in.
100%. Because what are you doing with 1 or 2 threads on each
and
side?
well,
Right.
that's what I
One
tell
or two
patients.
threads is for like a touch up. It's for like, oh, you come back in and we want to get just a little bit more. Okay, yeah, we're gonna put 1 or 2 threads in at that point, but like absolutely not.
Yeah, and what I like that
Worst
we
thing you
have
can
at
do.
our yeah, at our practice, we have like a demo, like we have one of the threads just to be able to show the patient. And when they tell me they only want one, I'm like, this little string is not going to hold up this big old fat gel.
No.
There's a whole process to it. So let me
Yeah,
go
we
through it.
keep threads in a little airtight container, and of course we have to replace them all the time because they're going to disintegrate over time as they're supposed to. But we let the patients touch them and feel them and
Mhm.
understand what the procedure is and what's going to happen and what's going into their face. And so, yeah, Shelby, I've never done that before. I'm going to do that.
Well, because I have to do it for my mom.
So-
My mom's always like, I just need one. I'm like, Mom, you know better.
Yeah.
But
It's
you have
like,
some, yeah, unrealistic expectations. And again, when I compare it to using filler, I'm like, again, my filler syringes are 800. You're going to need about 6 of them to get a good lift. Whereas I can do threads, and this is how much it's going to cost. You're going to save a little bit more money, but you're going to get a way better result with my lifting threads than with me putting in 10 syringes in your face and me not really knowing what's going to happen long term with the filler.
100%. It really makes it allows you to use filler the right way, right?
Exactly.
It
Yeah.
allows you to use filler to contour, to
Mhm.
increase volume, but we all know filler doesn't lift. And if you put too much filler, now well, it's hydrophilic, it's filling your
Mhm.
face with fluid. So you're
Mhm.
not getting the contoured result you think you're going to get if you don't lift that tissue. So,
Yeah.
I mean, filler is great. Filler, we need it. Contouring, loss of volume, but it doesn't do everything.
Yeah, and so again with my analogy for my patients, I tell them like building a house, my threads are gonna be the frame of the house. Let that settle. When you come back in, I'll use the filler, and then I'm gonna be putting up the drywall, putting in the furniture, and that's with the filler as I'm spot treating and putting in the fat pads. That still you need that little contouring effect.
Love that. Absolutely. Well, any last stories or success tips or anything that you want to share? You've been so transparent. Thank you about compensation to price range and skill set. So we truly appreciate that coming from experts and coming from, top accounts of PDO Max. Thank you so much. Anything last minute to add to
Yes.
this?
Absolutely.
Okay.
So, we brought threads on in 2020. Well, I've been doing threads since, well, when did they come out? 20.
14, 15.
Okay. So I
Oh,
think I
there.
started in
Wow.
2016. And, I was doing pretty good with them, but like there weren't not a lot FDA approved at that point. Um, and the first set that came out it was a surgical procedure. You could not do it by yourself. What a little bit harder to do, and so way harder to pick up. So about 2020 is when we started, I believe, with PDO Max, and I got my girls trained in 2021. Well, here's the thing. Not everybody is going to pick up threads. It is not like putting dermal filler in. And so there are complication risks that can come with it, and it's a different complication risk than it is with dermal filler. And so please, please, please get an FDA approved thread like PDO Max. Please get proper training and get enough training for your staff. The worst thing that you can do is bring on something to diversify your practice and to increase your ROI, and then it end up costing you more because you're trying to cheap out on the front side.
Yep.
Use a good thread and get good training.
And
Shelby,
Sonia, that's
since you're the national trainer.
Yeah, that's true.
the philosophy of PDO Max. I mean, we never really as much discuss our product as we do our training. You
Mhm.
know, it's very frustrating, and it has been for 50, so 2014,
Mhm.
2015. It really wasn't until 2020 that people truly understood how important the training aspect of it is.
Yeah.
It's like your first training, you're lucky to, I mean, there's so much going on. You're lucky to really comprehend what we're even doing. So, you know, we're big on that. Get your 10 faces under your belt and then do another training right away, because it is a great, great tool in the toolbox, only if you're good at it. Sonia,
Yeah.
you got it. And you know what? There will be some practitioners that just will never be good at it. Not
No,
because,
I have another nurse. It's not that she's not good at it. It's that it isn't
not
her passion.
passion. I was
And
just going to say, you have to be passionate
you
about
do
that.
have to be passionate about threads, and you have to understand them, and you have to want to use them.
Use them. Yeah.
And if you're not that person, I'm not going to make you do it. I don't make her do threads. Shelby took like, she was like a duck in water. I was like, I mean,
And
y'all
that's
asked me
really,
to be the national trainer. I've been doing it since 2010. Like, she surpassed me so quickly on threads, and nobody was prouder than me. I was like, oh, go Shelby. Like, that's awesome. So anytime I even have a patient that's passed my thread game, I'm like, okay, you need to go to Shelby. She's better.
well, you know, I think that
Like,
that's
she does
exactly,
things that I, don't even do yet.
it's the passion.
Great
It's,
point. Yeah.
Yeah, she has a passion for it. I do too. It's just, she really did take to it like a duck to water. So, good for her. I love it.
And I,
Sonia, the people who have been in the industry a long time, and this is, to me, the reason why somebody maybe who has been in the industry a long time doesn't become quite as passionate about it, is your book's already full. To
Yeah,
take
that's true.
another whole skill, I think this is a great skill for somebody who's 50% booked and wants something that they can become great at. I think it's harder to become great at threads when you're busy all day, you're training, you're doing all this stuff. It's 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 a game changer if you're passionate. You use the right word, passionate.
Yeah.
But the passion comes because they have more time to really study up on it, learn it. It's a different skill set. And
Yeah, I do think right after they train with dermal filler, they should also train with threads. And
yes.
I agree with you. Don't wait, like, because it is completely different than doing dermal filler. Wouldn't you agree, Shelby?
yeah, no, and I think also working with or being partnered with PDO Max and knowing that I can text anybody on my team if something happens or if I have a question about where to place this thread, I'm going to get an immediate answer and I'm going to always have that support. Like I said, with the training support, I love that PDO Max is big on training because me being out in the field and seeing it from a trainer's perspective, yeah, like I think it's really important, pushing and making sure these accounts are getting their 10 faces and immediately, like as soon as I leave, start calling people, getting them in your chair, or else it is also something that you can easily forget how to
Yeah.
do. And that's
Mm-hmm.
the other thing. And yeah. So, but again,
That's
I
a
love
really
that PDO Max is they're there for you no matter what. So
Oh yeah.
And
love the
it's
That's,
such a
support.
we
good
want people to
thread.
stay with
Oh,
you.
it's
We
such a
want
Yeah, I love
it's a beautiful
it's
product.
strong.
It works really well for our patients.
yeah.
very happy to hear all of that. And that also echoes, why we implemented the clinically confident skills day, really having a trainer go in after you've gone through that level one. And maybe you do need a little bit more time after you've done those 10 faces within that 30 days. So we've even implemented that to take it to another step, that extra layer if needed to create that clinical confidence. And that's what we certainly pride ourselves on.
Yeah,
Mhm.
I have to say, I'm grateful for my first sales rep, Taryn, who was from the industry, really driving into me and understanding how much clinical competence is
Mhm.
in this industry. And I think that as an industry, we've lost sight of that
Mhm.
sometimes. But we stick to it. Like Shelby said, we're there for you. The thing for me as a company owner is I don't want any provider to lose sleep at night over something that is an easy fix, or
Mhm.
we know what will, again, 11 years, we've seen it all. We know how it'll it'll move forward so that we can
Yeah.
help you navigate that and have the confidence with your patients, because really that's all patients care about. If they know you're confident about fixing an issue,
Yeah.
that's that's what is golden. If they know they can call you and go, hey, I have a problem, and you're there for them, it
Absolutely.
matters, and that matters to us.
Yeah, and I think for me, again, as a provider, knowing I had Sonia's back at Dr. Ellis had my back, Sonia had my back, and so I was a little, fearless in doing the threads and just wanted to do a bunch of different, techniques with the threads to give my patients a really good result because I knew the threads were gonna do amazing for them.
Yeah, every once in a while, I just have to call up Dr. Ellis and I'll be like, the insurance still good, right?
Yep, there you go.
Are we up to date on our insurance? Okay, good.
And I think
Yeah.
I have to say, insurance companies have come a long way with understanding
Oh
that.
yeah, yeah, definitely make sure, like a lot of people don't even know that breaking up your dermal filler, you're not covered under your insurance. So make sure you're covered for your threads, make sure you're covered for, all the different things that we kind of do with uh in the medical spa arena. You really have to check on that. But luckily you're using an FDA approved product. It's tried and it's true.
Mhm.
It's we've had no issues as far as that's concerned because we only use FDA approved products in our office. That's what we choose just as an office to keep it at a higher caliber.
Great.
Absolutely,
Well,
especially you're in Texas. That's the wild, wild west down
yeah,
there.
Oh, we are the
I
wild,
know.
wild west out here. It is crazy.
Well,
Uh,
it's
yeah,
interesting. They go the compliance side, the states go from no compliance to like too much
too
compliance.
much compliance.
Trust
Right,
me, I'm in
right.
New York. Every day I'm getting something
It's
now
a new
about
thing. It's true.
checking your med spa credentials. It's like, I think we should have worried about this 10 years ago. Like,
Right.
Well, and I think the last thing that I want to add to this, because y'all are just looking for those last little pearls about ROI and threads,
Hmm.
is like I said, dermal fillers down 15 to 20%. Patients are, it's just gotten a bad rap. It will come back
Hmm.
around. Don't worry, everybody calm down. However, this is when diversifying your practice is good. And also, patients are looking for something that is a little bit more natural and they're looking for more of that biostimulation category. Well, what do you think threads are? Yes, they are a procedure. They are a lifting procedure. However, they are the gift that keeps on giving. So when you can stimulate the patient's own natural collagen in their face, they are going to keep that, the studies say, around 5 to 7 years. Whereas with dermal filler, they're only going to keep that. Yes, we're finding it 7 years under MRI, but like, what is it stimulating? What are they getting to actually keep where they actually get that result? And we all know that's about 1 2 years if we're lucky with that dermal filler. Now, is dermal filler bad? No, that's not what I said. I'm just saying there's no reason that you can't use both of these in combination. But the patients love it because they know even when the procedure is done, they're not getting that lifting anymore, and it's time for them to come back in and put their new set of threads in. That
Hmm.
thread has slowly dissolved over 6 weeks to 6 months, and now it's created their own natural collagen in that pathway. You can even see it helping the texture of the skin. When they're a thread patient, over time, it takes some time. It's not something that's going to happen overnight, but actually the texture of their skin is going to get better. Even when you're
Hmm.
not doing anything topically, which you should be with the PDO Glow, but like just the internal threads alone.
Yeah, no, a lot of our patients that are new to threads and we have them come in for their follow-up, I mean, when you compare the before and after, their skin quality is different. They have a glow, and they love it. And showing them that, I'm like, yeah, this is what you got just from the threads. Imagine us the
Hmm.
rest of the PDO Max portfolio, adding the PDO, the Lumembi, the PDO Glow, the smooth threads, all of it. This is just the
Hmm.
beginning.
well, and
So,
it's funny because I think that's another idiosyncrasy with our industry is people want results overnight. Well, you didn't get
Hmm.
old overnight. Your skin didn't get bad overnight. You've got to give
Hmm.
the body that time to create that collagen. And to your point, Sonia, we had a client that when we first started doing threads, we did the middle of her neck and she was pretty sun damaged. 2 years in, because we were doing her every 3 or 4 months, the middle of her
Hmm.
neck was beautiful. The side of her neck had the sun damage difference was insane. We had
Yeah.
to then go in and do the side of her neck. So give it time, but threads are a game changer long term.
Yeah, long term.
Hmm.
Yeah. Well, even short term, if you're
Short term, yeah.
lifting threads, yeah. And I tell the patient and I tell other providers, if you want to get that biostimulation treatment for them faster, like let's say they have a special occasion. I mean, if not, where's the fire? Like, slow down, you're fine.
Mhm.
But if they do have a an important event coming up, you can put all of those smooth threads in and then send them into your laser room. You can do
Yeah.
laser, radio frequency, microneedling, anything that you want that's heat
Mhm.
related. What that's going to do is it's going to dissolve those threads faster, and then they're going to get their result faster. So now I don't know why you would be doing that when you have the topical PDO glow. I think that's a little dramatic, but is something about those threads being underneath the skin and rejuvenating in that area instead of on the epidermal level that really, I don't know, it's nice. So
It's
if you
They're
need to speed it
faster.
up, just
Yeah.
put them in your laser room.
I tell people doing smooth threads and then following up with any heat is like threads on crack,
Yeah.
right?
Absolutely.
Exactly.
We like things on crack.
Get there quicker. Absolutely. Well, thank you so much for all of your insight and the tips. This was amazing and so valuable. I think we could even do a part two, so we'll talk about that. There's so much more.
There's a lot.
So thank you, and look out for the spotlight soon. And we'll catch up soon. Thank you, Sonia. Thank you, Shelby.
Thank you,
Thanks,
Sonia.
Gio.
Thank
Being
you.
fun.
Bye.
Bye.
Excited to see you all. Bye.
Great. Bye.